Hey everybody, it's Dr. Jen here, and I am here for us to talk about how to prevent vaginal infection. So let's go. Alright, so I have so many patients that come into my office with complaints of vaginal itching, vaginal odor, irritation, burning, pain with sexual intercourse that keeps recurring and recurring and recurring. So most of the time, these conditions that cause these type of irritations are bacterial vaginosis, vaginal candidiasis, and trichomoniasis. So these are either a yeast or a bacteria or a sexually transmitted disease that can lead to changes in the microbiome of the vagina and cause for someone to feel those symptoms that I just discussed previously. It changes the pH of the vagina that leads to a lack of good bacterial growth and an increase of the growth of the bacterial vaginosis, vaginal candidiasis, or trichomoniasis that I just mentioned. So a lot of good ways to prevent this. One, for trichomoniasis, which is considered the STD, is of course to use condoms to protect you from getting these sexually transmitted diseases. But for the bacterial vaginosis and vaginal candidiasis, which are not necessarily considered sexually transmitted, however, BV is more common in people that are sexually active, and it is not technically considered a sexually transmitted disease. So to help prevent these from even occurring is to keep the pH of the vagina in the state that it needs to be in. So the pH of the vagina is acidic. It is a very special environment, and so many things can throw off the pH. So sperm, which has a basic pH, can throw it off. Using like Bath and Body Works and all these chemically scented soaps can cause that as well. That can throw off the pH. Using scented pads and tampons can throw off the pH of the vagina as well. And then of course douching, because douching then changes the microbiome of the vagina. You are flushing out good bacteria and then allowing the growth of these bacteria and yeast that I just mentioned. So what I recommend to my patients is to use a pH balanced vaginal wash. I think if you read online, some sites say it's not beneficial, but in my mind, just thinking scientifically and logically, if the pH of the vagina is different than soap, semen, blood, water, almost everything, why wouldn't using a pH balanced soap help keep the pH of the vagina in the range that I need for it to be in? So right here is the pH balanced soap that I actually use and that I recommend to a lot of my patients, and they say that it works very well for them. Another thing that can be done to help prevent these irritations, odors, etc., that can be caused by the bacteria that I just mentioned are using unscented, organic, unbleached cotton pads and tampons. As we know, these different chemicals can throw off the balance of the pH and then lead to those infections, as well as using unscented laundry detergents as well. As we know, we love our like super laundry scented soaps because it leaves us smelling really good, but putting that on your underwear can then throw off the balance of the vaginal flora. So using like a hypoallergenic, unscented, as natural as possible soap, and maybe wash your underwear separately from the rest of your clothes can help out. Also, another thing that I recommend to my patients as well is using boric acid, which is right here. So boric acid can help to keep the pH of the vagina, keep the bacteria flora, the good bacteria present, the bad bacteria at bay, and help keep you from getting these infections. I recommend that my patients get them off of Amazon. That's the best price that I've seen, and it is just as efficacious. It's not like it's a lesser of a quality. And you place it into the vaginal region. I say at minimum for 14 to 30 days at a time. You can't use it one here and one there. It has to be used on a pretty consistent basis of 14 to 30 days at a time. And it is toxic by mouth. So please do not take it by mouth. Please do not have your partner go do any fun things down there until you have finished with the regimen. So I hope this helps out in terms of preventing you from getting bacterial vaginosis, vaginal candidiasis, and trichomoniasis, and all of the irritating symptoms that we get if these infections are present. If you do have one of these diagnoses, of course, I recommend that you go see your gynecologist and get the appropriate treatment. And once that treatment has taken place and it's been cured and your symptoms have resolved, try this regimen that I just mentioned, and hopefully it'll help keep them at bay. So Thanks so much, and thank you for joining.